Okay, hello everyone. For those of you that do not know who I am, my name is Kara Welke. I'm an occupational therapist, creator of the Next Level Occupational Therapy platform. And today we have Rachel Wiley on with us.
Hi,
Rachel, do you
everyone.
want to tell them a little bit about yourself?
Sure. So I am an OT from Pennsylvania. I work outside of the Philadelphia region. I have my own small practice called Day by Day Home Therapy. I provide the Skills2Care Program to people with dementia and their family members in the Philadelphia suburbs. I also am kind of like a contract employee with Jefferson, so I help run some of the Skills2Care trainings and also working on some other dementia continuing ed, but that's later date.
Awesome. Well, thank you for being here. And okay, you
Thanks
guys,
for having
so
me.
I am modeling one of my new, well, not one of my, but one of our new gear. So let's see if I can show you. So I love this. It's a tank top. And it's kind of everything that we stand by here, being relentless, taking action, um, networking, finding your niche, desire, serving, passion, urgency. Yeah, lots of stuff. And then on the back says Next Level Occupational Therapy. So just had to give a
Awesome.
pop out. You guys ever want gear, let us know. It's from a small town in Minnesota, and they make all design all the gear and so forth versus what we ask them to do, and they're awesome to work with. So, okay. Hopefully, I want to say hi to everyone who is on first. We have 22 people on. Hello, everyone. Erin, hello, Angela, Megan, Alana, Emily, Deborah, Bethany, Ashley, Sue. Hey, Mike. Um, Caitlin, Stephanie, Megan, April, Kelsey, Kathy, David, Willa, Lauren. Okay, look at those muscles. Yeah, right. I
Good
don't have
group.
any muscles, but thanks. Okay, so you guys had a great discussion going on here. I think it can't remember if it was Thursday or Friday. Someone posted in the group about certification. And then I kind of popped in and gave a little spiel of my thoughts about certifications. And then I talked about the Skills2Care program. And I know that, and then a lot of people were interested in the Skills2Care program. So, first thing, I'm just going to back up to certifications. Um, I think you really need to think about what certifications you decide to do and how that is going to impact your what you're currently doing. So some certifications may add value to just your overall general practice, but some certifications may actually help bring even more income to your practice. And I have a few certifications. I did the Parkinson's Wellness Recovery Program, and I absolutely love that program, and I utilize it with all of my clients, not just my clients with Parkinson's disease. So that's was one of my favorite certifications that I have gotten. And I have like Tai Chi and the Ohio Health Delay the Disease. I'm a certified lymphedema therapist, which is I use all the time as well. But my most recent certification, I actually took with Rachel. So we brought her on so she could educate you a little bit more. But it's called Skills2Care, and it's a program for caregivers of people with dementia. And why I feel this certification is so powerful is because it fits perfectly like with my practice, and we help lots of therapists start their mobile Medicare Part B practice. And I feel this certification program is great for those therapists because they have it literally set up like what we do on session 1, session 2, session 3. And it's this great process and program, and it's evidence based. I mean, they have research to support it. So it's not like a certification you go and you learn this stuff and then you have to figure out how to implement it into your practice. It really works well. So I'll give you an example. So I've been working with a client And his big deficits were just overall decline in overall occupations. I mean, not doing anything, sitting in the recliner, but decreased balance, decreased weakness, just more assists needed for ADLs, IADLs, all around. And so started seeing him, and this was before I even kind of had that skills to care background, thinking, this would be good for him. Well, as I started working with this client, I could see the stress and um, oh, anxiety, even depression, and just the frustration the caregiver was having with this client. So this client has mild cognitive impairment. I mean, he's hilarious. Like, I could literally laugh the whole time I'm there. And I think he makes it a goal that I'm laughing nonstop because he's just a jokester. But yet you could tell that it really frustrates the spouse. So I actually talked with Rachel, and then I talked with the client, with the caregiver, and we started implementing the Skills to Care program with the caregiver. And it's great because the caregiver actually has never really had anyone talk to her about what she's dealing with, what she's going through, and how to best handle behaviors, situations that come up. And what I think is so cool is this program is covered and can be billed under Medicare Part B. So we can do it in the home. You can do it on telehealth right now because of with COVID and everything, but it's just designed really well. And I'm going to let Rachel tell you all about it, but I just wanted to give you from kind of a newbie perspective and a mobile Part B perspective. This is great. I actually also met with the North Dakota Alzheimer's Association, and they set up a meeting where I met with all of the different like care coordinators throughout the state, and then we went over the Skills to Care program with them, and they were totally excited to collaborate and work together with clients in my local area as well as throughout the state. And they even called and talked to me about Minnesota, because I'm licensed in Minnesota as well. But and Rachel will go more into depth with it. But during the first training, they have this awesome assessment that is actually designed by the creators of the program. And it goes over, I'm just going to give you a few examples. I know I can't share everything from the program, but it just really helps kind of figure out where the caregiver is struggling. So it goes over things like, let's start with the typical day. So let's look at your morning, afternoon, evening routines. And then there's probing questions to really dig in, to work with that caregiver to figure out what is going on. And then we look at all of the different ADLs and IADLs and what kind of things, what are challenging for them. Then we look at, how do they do handling certain situations or behaviors. And the assessment goes through all sorts of different challenging symptoms and how often does the person have them? How does the caregiver do with handling them? And it focuses on caregiver concerns. And basically, by the time you're done with this assessment, the caregiver is picking their target problem areas that we're going to be working on with them. And it's not us going in and telling them all of this, but it's all about creating or brainstorming and getting them to really buy into the process so that they can kind of take ownership. And when a new behavior, a new problem occurs, they can kind of go back to this problem solving action step and create their new strategies for how they're going to deal with new and upcoming behaviors and so forth. So just their assessment alone, I think is so valuable. But then it's just awesome because, before I go to my visits, I go through session 1. This is what I need to do. Session 2, this is what I need to do. Session 3, and it goes through the whole program. So it's awesome. So So I'll let Rachel take over. But as a mobile Medicare Part B practitioner, if you enjoy working with clients with dementia and their caregivers, this is a great add-on to your business. And Rachel and I were just talking about this. I'm not an affiliate. I don't get paid for anything. I just believe that this program will work really well with you guys that have mobile practices. A great add-on and thing that you can market in your community, because more and more people are wanting to stay at home, right? And caregivers, we know the stress and the burden that they go through, and this focuses on them and keeping them safe and healthy, and stress management, all sorts of things. Okay, so Rachel, you take
Yes.
over. And for
Okay.
those of you that are listening, please put your questions in the comment section and we will answer those as we go through. So
Absolutely. Thank you for all of that, Kara. And I should add too, obviously if I'm doing the trainings at Jefferson, I do get paid to do those trainings, but truthfully, I just really love this program. I tell everyone I'm Skills2Care's biggest cheerleader. The whole reason that I started my practice was so that I could continue to offer Skills2Care through an outpatient insurance benefit model. So, it's not like I started my practice and then backtracked and found Skills2Care, or was the kind of person who just really wanted to start a business. I just really love Skills2Care, and so I started my business. So that's kind of why I feel so passionately about this. I'm also, a huge fan of continuing to have more occupational therapists certified in this program, because I see every day how needed this program is. I actually was just thinking of a client of mine recently. I remember bringing a handful of students with me, obviously before COVID, to shadow one of my Skills2Care sessions, just so that they could kind of see a little bit about the program. And the family was crying because they were so happy that other occupational therapists were going to be trained to offer this program. So it can be really, really powerful to see how, the impact that this can have on the families that you're working with. Like Kara said, we know that a lot of caregivers are not asked about themselves. A lot of therapists, we focus on our patient, which there's no fault in that, but Skills2Care really urges you to say, okay, when working with people with dementia, we have to consider the dyad. That person with dementia cannot be treated in isolation. We have to consider what the caregiver is going through. And so that's what Skills2Care is all about. So Skills2Care can be a standalone caregiver program. So you don't have to involve a patient. So, I have some clients where for whatever reason, they don't want the patient involved in the process. And so they might pay privately just for a consultation. That's fine as well. But the beauty of Skills2Care is that when you integrate it into your patient's plan of care, that you can get it covered through insurance. So there was translational research done to show that it was covered through a Medicare Part B model. So I think they used a fairly large, well-known Med B practice when they did that translational research. But we also know that it can be covered through Medicare Part A as well. So I know that's not as common in the Next Level group to see Med A business owners, but if anyone out there is in a Med A environment, that is absolutely done as well. So all of that being said, I'll review a little bit about what the training looks like. So a lot of people ask about cost. Yes, the cost is $2,000. That's the initial certification fee, and then every 2 years, I believe the recertification is $200. The certification process, you do about ballpark of 8 hours of online readings and modules prior to the 2-day, we used to call it in person, but now it's the Zoom classes. I say ballpark because some people can get through that, a little faster than 8 hours. And then we're changing the model slightly from when you went through it, Kara. We're now doing 2, instead of one really long day and one half day, we're doing 2 regular days. So it will be 2 Fridays, back-to-back weeks with just, that normal. I think we're switching the times as well so that we can accommodate people in different time zones. So I want to say it's like, I think we did 10:30 to 5:30 Eastern Standard Time, something like that. I can double check. I know the Skills2Care website does have the dates and times on it for the upcoming trainings. And I can look that up while we're chatting if anybody wants to know that. So again, there's those 2 days, and then following the 2 days, what I really like about Skills2Care too is instead of just going to the training and then saying good luck, I liked Skills2Care when I initially got certified because of the coaching calls. So there are 6 months, we do at least 5 coaching calls spread out over 6 months, just to kind of answer questions and make sure people feel comfortable with the implementation of the program. So making sure that, if people have clinical questions or they're trying to figure out how to modify the program to best fit in their environment, whether it be Med A or Med B, we try to help with that. I think there were also some questions at some point about billing and learning how to bill for it. Truthfully, the program itself, the certification training, does not cover how to bill, because Skills2Care can be billed through a variety of means. It can be private pay, it can be grant funded, Med A, Med B. But that being said, if I'm the one to run the training, I'm happy to provide my personal insight into how I bill from a Medicare Part B perspective and what I know from my little bit of time when I did it through Medicare Part A. So again, it's not an official part of the course, but if I'm the one training, I do my best to offer any insight. I'm not a billing or documentation pro by any means, but I do what I can. So again, those coaching calls we just kind of get together as a group. We talk through any questions that people have. And then as the coaching calls progress and people start to finish up their cases, they will provide a case report. So we have just a guideline of questions just to make sure that, everyone really grasps the program and make sure they feel comfortable and confident in what they're doing. So we ask that by the end of those 6 months that people have provided Skills2Care to at least 3 to 5 full cases, and then they'll provide a case report and documentation for 1 case. And then you're officially fully certified. And every 2 years for recertification, people just do 1 other case report with that documentation. And again, I believe it's a $200 recert fee. So not too complex after the initial certification process. Like Kara talked about, it is, I think of it as being, it has structure, but you can provide it in a flexible format. So, we have session 1, we have the different components that we ask that you complete in order to get through your session 1 of Skills2Care. But the great part about that is it can be adapted in terms of the order in which we provide those things within session 1. We can integrate part of it into our eval. We can wait and do session 1 during our second occupational therapy visit. If we can't get through all of session 1 in 1 visit, we can split that up. So there is some flexibility to make sure that it works for you and your clients. And we recognize that dementia care is not very structured, and you can't really know what to expect when you walk in. So we recognize that you're going to need to be able to adapt it to work for your caseload. I also really like Skills2Care because it kind of teaches you how to adapt based on where the caregiver's at. So we talk a lot about the idea of caregiver readiness in Skills2Care, and caregivers who are struggling with a diagnosis or maybe not as, ready or willing to implement strategies and how to handle or address those caregivers. And then on the other end of the spectrum, the caregivers who are high readiness, already trying their own strategies, and how to really support them so that they can move forward as well. Again, Kara also talked about, this process of making sure that the caregiver feels empowered. The reason that it's called Skills2Care, and it used to be called the Environmental Skill Building Program, the entire point is that we're hoping to build the skills of the caregiver. We want the caregiver to feel empowered. We want them to understand the process of how to address behaviors, how to understand the interaction between the person with dementia and their environment and how the caregiver influences that. And we really want them to not only be able to handle the issues at hand today, but hopefully build those skills so that in the future, when a new issue comes up, because we know that it will with dementia, that they now feel like they have the skills to address that. So I hope that gives you at least a general overview of what Skills2Care looks like. Do we have any questions, Kara?
Anybody have any questions? We have lots of people on, some new people. Abby, hey Deborah, hi Jessica, hi Myra, Melanie, Phyllis, Elsa, Janie, Megan, Melissa, Josie, a lot of different people on. Do you guys have any questions about the Skills2Care program? If you do, now's the time to ask it, because you have Rachel on, and she does the trainings and she's a great support person. For instance, yeah, she goes above and beyond, because I know with my first client, I was like, had a gazillion questions and she was there okay, ready to answer all of my different questions as we went through the program. And it, I do want to point out, it is just for occupational therapists, and occupational therapy assistants can get the training as well, but you have to be working with an occupational therapist that's also trained in the Skills2Care program.
Exactly.
So, anyone have any questions out there?
And I should also kind of mention too, well, not should, but I would like to, I love the idea that Skills2Care is just for occupational therapists. You know, some people kind of come to me and like say, well, why can't other professions get certified? But I love that this is something that's just for us. You know, we're always talking about how do we promote occupational therapy in the field? How do we become stronger as a profession? How do we... OTs we do activity analysis, right? We understand how people can engage in daily occupations and how the environment influences that and how other people in their environment influence that. We're the best people to be doing this type of work. So I feel very strongly about Skills2Care being for occupational therapists, and I would love as many OTs as possible to be doing this type of work, because I really think that we're the best professionals for this type of diagnosis.
Awesome. Yeah, it is neat to have something that's specific to your profession that not everyone in the world can get trained or certified in or whatever. So we do have some questions. So Kathy, great question. Is there a set number of sessions in the program?
That's a good question, Kathy. So when providing Skills2Care in its full evidence-based form, the minimum number of sessions to complete the program is 3. 3 sessions would be required for a caregiver who only identifies one target problem area. We describe this a little bit more or a lot more when you're actually in training, but it really is dictated by the caregiver and how many problem areas they identify. So if the caregiver has, let's say, 3 target problem areas or 5 target problem areas, you're going to add more sessions, because our goal in Skills2Care is to address one area at a time to make sure it's fully addressed, fully taken care of before we move on to other challenges. I would say the average for me is probably about 10 to 12 sessions. Some people, the average is a bit less. Really depends a lot on caregiver readiness and caregiver, the number of challenges that the caregiver is facing. You know, my clients who come to me and they say, you know, my family member is physically aggressive, verbally aggressive, wandering in the home, shadowing, wandering outside of the home, and, you know, they list 20 different issues, I'm probably going to be working with them for a longer period of time. Somebody who says, you know, things are going pretty well, but I would really like to know better how to, you know, minimize my family members' agitation through activity engagement. that's going to be a shorter case because we're only addressing one issue that's maybe not extremely challenging in nature. So good question, Kathy. Hopefully that answers your question.
And then how do you market the program in your practice?
That's another good question. So again, I'm a little unique in that my entire practice is my program. So they're kind of marketed hand in hand. I definitely do a ton of marketing in different networking groups in the Philadelphia region that are geared towards professionals who work with older adults. I do a lot of marketing at adult day programs. They're really, really great referral source for me because oftentimes caregivers who are bringing their family member to an adult day program, many times are doing so because maybe they're burdened or experiencing challenges at home. I also do marketing with non-medical home care agencies. Like Kara said, whether it be, your local Alzheimer's Association, sometimes they're receptive. The Philadelphia area, they're a little reluctant to refer anyone to any sort of private service because they feel like it looks like they're affiliated. And so they're a little finicky about that. But like Penn Memory Center, they're one of the biggest, I think they're probably my number one referral source right now. So you can certainly find those places in your area that cater a little bit more towards people with dementia. It depends on the support group. Sometimes support groups really like the idea of you coming in to provide some education and then might allow you to do some marketing in the process. Again, I try to tread lightly there because I know that's a really safe environment for people. So I try not to market it too strongly, but a lot of it's word of mouth. Once you start doing this type of program and it catches on, I think I was saying to Kara, or I posted somewhere, pre-COVID, I did more marketing, especially when I first started my practice, I did more marketing. But then I actually temporarily closed my practice while I figured out how to best navigate the COVID world and reopened in purely a telehealth format outside of my clients on hospice, but that's another issue. So all I did when I reopened was I put up one Facebook post and one Instagram post. I didn't contact referral sources. I didn't let people know, I'm back open, but slowly word got out and I am now busier than I used to be before COVID. So I think of all times in history, now is the best time to be targeting caregivers of people with dementia. They are incredibly burdened. They don't have the resources that they usually have because they're not sending people to adult day programs. They maybe don't feel comfortable having non-medical home care in the house. So I think now more than ever, Skills2Care can certainly help support people. So sorry, that was a ramble, but hopefully it gave you some ideas about marketing.
So true, because clients are stuck at home. They have social isolation and it's impacting the clients and the caregivers more than ever. So it is a good time to add this to your business model. Okay, we have more questions. Keep the questions coming, you guys. Deborah, she said, it sounds wonderful. It is. It's just a really good program for occupational therapists and fits well into the mobile outpatient practice or telehealth, like Rachel was mentioning. Ooh, I know what I was going to ask. Rachel, can you tell them about how you came up about your name and why you even started doing your business?
Absolutely. I can talk about that. Thank you, Kara. So, I think a lot of us have some sort of connection to dementia. It's very prevalent in the community. But my grandmother and both of her sisters actually passed away with dementia. Their maiden names were all Day. So that's why I named my practice Day by Day Home Therapy. So, I really, my grandma was diagnosed with dementia, I think when I was in undergrad, maybe. So I have always been interested in working with older adults. I've been working with older adults since I was 14 or 15, I think. So this has always kind of been on my radar. But then seeing firsthand the lack of knowledge of not just the community, but especially healthcare professionals who, as a younger person who at that point, hadn't graduated, I maybe was in an OT program, but, you trust the healthcare professionals around you to know what's best for your family member. And when I could see firsthand that they were not really understanding dementia care, that was a huge motivation for me to start doing more in the dementia care realm. And then when my grandmother passed, my mom actually shared some of her inheritance, and that's how I had the funds to start the practice. So that's why we named it Day by Day Home Therapy, and my mom's my volunteer office manager. So we're very motivated to try to provide as much community support to families going through situations like this.
Awesome. Thank you. I just think it's powerful, and people know why you started your business and so forth. So, okay. Elsa agreed that we need something just for OTs and the specializations we address. Emily has a great question. Is this applicable for people in assisted living facilities who do not have someone living directly with them, but receive support through the facility?
That's really, really good question as well. So I will say that Skills2Care in an assisted living facility is possible, but it is challenging to provide it in its full evidence-based form. I think that there are definitely components of Skills2Care that are valuable in an assisted living. The challenge is that a staff member may not have time to sit down and engage in the full program with you. If you can find a formal paid caregiver who has the time to do that, I think that that's definitely the way to go. But many people who go through the Skills2Care training and who work in assisted living find that they are providing a modified version, or they're using the research or the evidence that supports Skills2Care to inform their treatment, but they may not be providing the entire program. When I provide the full Skills2Care program in assisted living facilities, it's usually because the person with dementia has some sort of outside person coming in. So it might be that the family chooses to come in. I know, again, COVID, this is a challenging time to do that, but under different circumstances, the family may choose to overlap with my sessions, and they can participate in Skills2Care and then work with me to educate the staff. Other people may hire their own non-medical home care as a supplement to assisted living, in which case I can do Skills2Care with that person. So those are the most common ways that I do Skills2Care in assisted living. But again, I have had people come through the program, and I do use modified versions, using the evidence to inform my treatment, but I might not be offering that full evidence-based program in a memory care or assisted living. Good question.
Awesome. Lori said, can you talk more about the options with private pay practice? And,
Sure.
and I'll have Rachel answer that, but Lori, can you also, just so we know a little bit, like what kind of practice do you currently have, maybe, so we can kind of help
have some
that
context.
a little bit more.
Yeah.
Just because, I'm a big, if we're working with clients that are Medicare and have Medicare, we have to be billing that service to Medicare. So just something to think about with that. But okay, Go ahead, Rachel.
That's exactly what I was going to say, Kara. We can offer Skills2Care as a stand-alone program to caregivers for private pay. So if the person with dementia is not involved in the process at all, then you can offer Skills2Care as a consultation service to a caregiver. You're not providing patient treatment, so therefore you can bill them out of pocket. However, if it's appropriate and doable to integrate this service into a patient's plan of care, I think that's the most ethical thing to do because then we're providing a service that benefits both the patient directly and the caregiver and would be covered by Medicare. And in that case, we are obligated to bill Medicare. I hope that answers your question, Lori.
And you guys, it's okay. So I just have to tell you this story. So my current client, and I always say my favorite client, but my children have informed me that all my clients are my favorite clients.
The same thing.
But so we've been really working on activity engagement and getting the client to be doing more than just sitting in the chair. Because when he's active, when he's doing things, He doesn't complain about his pain as much. He doesn't, drive his spouse, she gets frustrated when he's constantly, talking or whatever. So we have this program or kind of a home program. I'm not big on home exercise programs, so I try to do functional activities. And some of the things he used to help with around the house all the time were like sweeping and vacuuming and dishes and things like that. But so now when I go to the house, I usually start with the client. We do a few things. Oh, and I think I talked about this before, but he loves to hunt. He loves to fish. He is an auto mechanic and so forth. So anyway, so his home program includes things like sweeping, vacuuming, writing about certain topics. So I go and I get him started and I'm like, okay, let's work on your program. I'm going to go talk to your spouse, the client or the caregiver. And we go outside, we kind of work through the skills to care. And one day I came in and I was just like, so happy. He was sweeping. He was busy sweeping away when I got there or when we came back in. So that's why I like integrating them together. So again, he was doing, I don't know, I was just so happy that he was sweeping. Then another day I got there and he was so excited to show me what he had written. So he had written up this whole thing about gun safety and utilizing guns appropriately and so forth with hunting and so forth. And he was so excited and he wanted to read it all to me. So again, the power of integrating it together. And it seems to work well. Like I get him started on things to do. I go out, work with the caregiver, then kind of come back and try to role play model things because she doesn't want him to do quite as much because she's worried about him falling or things like that. So like the other day, we went outside and he pulled in the garbage and, did things and just kind of how about like when he's getting kind of starting to get agitated or complaining of pain, let's just get up, let's go outside, walk around the block or do this. So yeah, I think the power of being able to work with them both together is awesome. So
absolutely. I was actually just saying this. People were asking me about the pros and cons to doing this via telehealth. And that would be one of the challenges for me now that I found a huge value in when I was in the home was being able to model and demonstrate with the person with dementia what those appropriate strategies are is so powerful, right? To be able to set them up with an activity or engage them in toileting without aggression or whatever it is that you're working on. When you can model those strategies, I think there's an added level of trust and comfort. My clients who are on my caseload for telehealth right now, who are coming back to me from previous episodes of care, there's already an established level of trust. We've already, addressed multiple issues. So we can move forward already with some pretty solid respect, rapport, trust. But my new clients who are coming to me, I sense a little hesitation because I can't yet demonstrate directly for them. I'm still communicating to the person with dementia, for a portion of the session, just to kind of check in and build rapport with them as well. But the level of rapport building is a totally different level when you're in the home and you can be demonstrating these skills with the family. So that's a huge benefit of doing it in the home and a challenge with telehealth. And then on the flip side, one of the benefits of telehealth is when you have those cases where the person with dementia is triggered by you being in the home, right? So if you're trying to have a conversation with the caregiver and the person with dementia has paranoia or, they're shadowing the caregiver and you can't get those couple solid minutes of education or conversation that's going to progress that level of care. When you're doing telehealth, it's easier because you don't have a physical presence in the home that you can have some one-on-one time with the caregiver, or you can talk more candidly because maybe the person with dementia can't hear you if the person has their headphones in, right? So some things to consider, but I'm hoping that telehealth will stick around moving forward because I think being able to make that judgment case by case and figure out what's going to work best for each family will be great. Because otherwise I was trying to, I'd have moments where I'd be having caregivers walk me out to my car, or sitting, if it's raining out, sitting in my car with the caregiver, trying to provide some skills to care because my presence in the home was creating too much stress or agitation, right? So being able to have telehealth as an option, I think will be really great for skills to care moving forward.
Well, I can see the benefit of telehealth, down the line or intermixed, because
Yes.
you don't always need to go out to review or add or adjust or whatever. So having it mixed in would definitely be a huge benefit as well.
Absolutely.
Let's see. Sue noted that she's seeing so much more stress on the caregivers right now. She wished she had some more to offer. And yeah, I mean, it is a very stressful time, as if it wasn't stressful enough already.
Right.
Yolanda, yes, you will be able to watch this from the beginning, so don't worry about that. Kathy asked, how long is a typical session? So,
good question. So I was going to say, especially when I did this in the beginning, when I was learning how to do skills to care, they were long because it was, a learning curve. I'm trying to figure out what I need, and there's some documentation or paperwork involved. So you're trying to figure out, what's the best flow? How am I going to make all this work? It's definitely an art to figure out, how do you have these challenging conversations with caregivers in a way that's time sensitive, because again, caregivers haven't been really asked about themselves to this degree, most likely by any other professional. So when you open up that potential can of worms, sometimes there's a release, like, oh my gosh, I have so much that I need to tell you. So it's definitely learning kind of that art form to figure out, how do you gently redirect? How do you figure out how to kind of cut them off or change, redirect the caregiver? So that is challenging. I would say my current sessions, because they're telehealth, I can kind of be a little bit more prescriptive. I block out an hour and 15 minutes for my current sessions. I don't always need that much. In the home, I used to block out an hour and a half. Some of my clients, I learned that our sessions will be longer. They'll be closer to that hour and a half. Other clients, I might need 45 minutes. So it really depends a lot on your confidence, your skill set, your comfort level with the program, and also definitely depends on the caregiver. And again, I love the Med B environment because I have that flexibility to have long sessions. I prefer to see my clients less frequently for longer. So I usually see my clients about once a week for an hour to an hour and a half. When it's integrated into Med A, that's not usually realistic. So a lot of times they'll split those sessions up and maybe do 2 45-minute sessions a week, or something like that. How about you, Kara? How's it been working for you?
Yeah, like right now, I'd say about hour 10, hour 15 minutes. I'm trying to get it down to closer to that hour time as I'm getting towards the end, and trying to empower the caregiver to really take over. But yeah, I might have had like a 2-hour session at like my first
Me too.
one, just because there is so much to cover. And when you get in and are really working on this, it's like you can't really say, oh, well, let's go. I will focus on it next week. So a couple of the first sessions were definitely longer and more towards, I know I had 1 or 2 closer to that 2-hour time zone. But
I've definitely been in the same boat. I mean, even now that I am really, really, really comfortable with the program, I certainly have my sessions that are longer. But I also have learned, more about what I want to devote more time to, where I wouldn't want to break off a session. Like, I know if you take the Skills to Care certification, you'll learn about this kind of problem solving and brainstorming method that we have. I never want to potentially cut that off. So I like to start a session with that. So usually if we're on the fence about, do we have enough time or do we not, I'll table that and push that to the next session. So you kind of learn what will work for you, what's your style. And again, some caregivers, you learn if they're some caregivers are very just, they'll answer the questions. They just want to get it done. They want a strategy. They want an answer. Other caregivers, I think, they just need to be able to talk some things through. So you'll learn that some of them will need a bit more time.
Yeah, for sure. And that's what I was going to say. Like when you're in the dip depths of going through like the problem solving, worksheets and so forth, you know, you can't just, you know, cut that off. So
right. That's harder to do. You'd have to start it over the
yep,
next session
exactly.
to be in the flow, right? Yeah.
Exactly. Okay, other questions that you guys have? Elsa said, excellent benefits of telehealth in combination of direct care. Yes, I think the combination can work well together. Hi, Sharon. Kimberly, thanks for watching. Hey, Kevin. Amy, Kimberly, Megan, Alicia, Yvonne, we got some new people popping on. So for those of you that are just popping on, we're talking about the Skills2Care program. That is a program for caregivers with dementia. And I also, so if we have people listening that are PTs, speech therapists, and so forth, there is Mike Chua, who was on, I don't know if Mike's on anymore, but he does a dementia training program that is for all healthcare professionals, and you can work towards a certification in becoming a certified dementia practitioner. So, you know, that's an option or something that you could consider if you're not an occupational therapy professional, since the Skills2Care program is specifically for occupational therapy professionals.
And then also for those of you who do end up getting certified, I did tell the most recent group who came through that I was grandfathered in as a certified dementia practitioner because of my Skills2Care training and certification. So something to consider, you know, again, that's something where Skills2Care maybe isn't as well known as being a certified dementia practitioner. But we know that Skills2Care is very extensive in terms of the services that you're offering to caregivers of people with dementia. So the organization that runs the Certified Dementia Practitioner Program did review everything when I submitted it and said, yes, Skills2Care qualifies for that. So I'm now a certified dementia practitioner because of my completion of the Skills2Care training. So something to consider.
Yes, yes, and that's a huge benefit as well. So, okay, well, I know we covered a lot. Rachel, your next class is coming up in August, right? For Skills2Care?
Yes, I can, let me see if I can pull up the website really quickly. Yes, the next class is in August. I'm not sure if they've kind of like close to the registration for that or not, but it's certainly worth reaching out to Kathy DeClerico. So I'm gonna, let's see. I just Googled Skills2Care Jefferson and clicked on their link. So it says professional training Skills2Care. It gives the times and dates. So the next one coming up is August 14th and August 21st. I think that one, yeah, that one's coming up shortly. And even though it looks like it gives you Catherine Pearsall's contact information, I'm going to tell you here now. If you're interested in Skills2Care, the contact person is Catherine DeClerico. Her name is spelled with a K, Katherine DeClerico, at jefferson.edu. I can always put that in the comments as well.
Yeah, that'd be good.
She's the admin support. She does the registration, sets everybody up for trainings, organizes all that good stuff. After the August 14th one, the next one that we have scheduled is in October 30th and November 6th. So awesome. If you can't make the August one, maybe we'll see you in October.
Awesome. Wait, one more question, Missy. Yeah. When do you plan to start doing in-person visits again, if there's even a good answer for that?
Great question. So I was considering at one point when cases started to go down in this area, and now that cases are going back up again, I'm just trying to weigh the pros and cons for each particular client and figuring out case by case what's best. I am also having difficulty getting my hands on an appropriate volume of PPE. So I think if I felt like I had the volume of PPE to protect every patient to the degree that I would want to be protected if I were in their shoes, then I would consider it. But right now I feel like Skills2Care really can be effectively offered via telehealth. So I'm feeling comfortable and confident doing that. And honestly, the majority of my current caseload has told me that even if I offered in-person sessions, that they would opt for a telehealth session. So, at the moment, I keep reevaluating every few weeks. But with the cases continuing to go up, I'm feeling like I'm trying to keep my clients safe as long as I feel like I'm offering them good quality care. Sorry, that's not a concrete answer, but I'm doing my best.
And yep, nope. And Missy, I actually am doing in-home visits. We have a protocol that we follow, and we offer telehealth if that's what people want as well. But so far, the people that we have want us to come in, and we shut down for quite a few months there too before we started back up again. But I know now with things kicking back up, yeah, there's always that uncertainty of what's going to happen. So having that telehealth option is definitely a plus. Okay. Any last minute questions? Going once? No, just teasing. Do you have any other questions? Please.
The other benefit of having telehealth as an option, is that because there are so few therapists certified in Skills2Care, compared to some other certifications, we might be the only Skills2Care Med-B provider in our state, or one of only two. So then we can cover a much larger geographic area. We have a much larger group to market to. So just something to keep in mind as well.
Yeah, that's huge. Do you know how many Skills2Care professionals there are?
No, I asked Kathy this the last time I chatted with her, and I think she was going to get back to me, but I don't know if I got that answer. I will say, some people let their cert lapse if they change locations. I will say prior to maybe this crew, the majority of people getting certified in Skills2Care were Med-A therapists. So they were large Medicare Part A companies who were sending large groups of their therapists to get certified. So then those OTs, as soon as they left that particular agency, maybe decided not to keep up their cert, or maybe they couldn't because the agency was the one that paid for it. I don't know all of the logistics of that. So we don't have as many Med-B people, although I'm very happy that that's starting to change. But if I had to guess, I would say probably less than 100. I would think there's less than 100 of us. So I think that that's luckily changing. We're seeing some shift in that. And I think, Kara, you and I both have talked about that. We feel strongly that there should be more of us. But also, the Dementia Society of America, I do a fair amount of work with them, and they've been really pushing as well that if there was a way to have any sort of partnership, that they would love to promote Skills2Care to help more OTs across the country get certified as well. They would also like to work with us to create a searchable database of Skills2Care certified OTs too. So hopefully we can make some of those things happen. But right now, there aren't a ton of us, which again comes with pros and cons. One is we have more clients that we can market to. If there aren't that many of us, then we have a lot of potential clients. The challenge is that maybe it's not as well known, but again, I think we're slowly but surely changing that.
Right. And yeah, and for those of you, so we have our Therapy Business Builder program where we help therapists start and build their business from the ground up. And yeah, Rachel and I have been talking because I would like this to be kind of like an add-on or a situation where we could, everyone or those OTs that are in the Therapy Business Builder program, that they can add on like the Skills2Care training. So we hope that we could get that figured out someday. Yes. We have a home mod and safety kind of add-on program. So it'd be so awesome to be able to add on that Skills2Care program for those that are building their Medicare Part B business. So
definitely. So we'll keep working on it.
Yes. Okay. Well, you guys, I guess we've hit about an hour mark. So thank you guys for being on. If you have additional questions, put them in the comment section. If you're watching on replay, if you could put replay so we kind of know how many people were able to watch this. And again, reach out if you have questions or put them in the comment section. So have a great Sunday. Thank you, Rachel, for
Thanks,
taking your
Tara.
time and hopping on with us to talk about the
Of
Skills2Care
course.
program.
Thanks
Have a
for
great
having
day,
me.
everyone. Bye-bye.
Bye, everyone.